today I want to tell you about a very serious public health issue affecting Sri Lanka, which is not only affecting Sri Lanka, but I will talk about its effects, impacts, problems, economic consequences to you, people of Sri Lanka. I am also a person in Sri Lanka. Road traffic injuries, associated deaths, and road traffic crashes is a severe public health issue affecting the people of Sri Lanka. Each day, 8 to 9 people die from road traffic crashes on the roads of the country. Whether there is rain, no rain, whether there are mosquitoes or no mosquitoes, whether there are any other issues, still these numbers die daily. And not only that, from road traffic crashes on the roads of Sri Lanka, another large amount of road users get injured, 1/3 severely, with consequences for life. They most of the times ends with disabilities affecting their whole life. And interestingly and importantly, the biggest issue in this is mainly 15 to 49-year-old young males are affected more than the other groups. So these are young people. We are a developing country, a poor country trying to become a developed country, and one of our major assets, main assets, most important asset is humans, especially young males. And when they get injured, they get killed. Not only we lose them to the country, to our society, but their families also suffer. And majority of these people might be not very wealthy, not economically viable, and when they are injured and dead, their families most probably all at this moment even will be pushed to poverty, and most probably the poverty alleviation programs established by successive governments might not be working in Sri Lanka, maybe because so much of people die, so much of people get injured. And then the other serious issue is the economic impact, economic cost of road traffic crashes to the country, the government, the people of the country. Actually, 2 to 3% of the GDP is lost. There are various calculations, various people have calculated various amounts, but I think important estimate is about 2 to 3% of the GDP lost from road traffic crashes to the country. Huge loss. Then the next is our hospital system. Any person who is injured will be taken to a government hospital, and this person will basically block a bed in our wards, which will be needed and which can be used to and for other people. And this will also make surgeons, doctors, healthcare people to most of the time postpone routine operations, surgeries to cater to these injured road users. So there is that issue also. It's a social issue, it's an economic issue, it's a huge burden to the healthcare sector. And then why aren't these coming down? Mainly because although there are a lot of programs initiated by the government, other people, various organizations like the Sri Lankan Medical Association, these are not coordinated. They don't basically do together. Everyone does things in their own spheres, in their own rooms, in their own ministries, and in their own areas. So therefore some programs are duplicated, some are not even done in any sector. Various organizations, various ministries like the Ministry of Health, Ministry of Transport, Ministry of Highways have programs, do programs, but daily, continuously, our road traffic crash deaths and as well as morbidity or injuries increases. And if you look at the war, we had a war for about 30 years, which finished in 2009, and since then, more people have died from road traffic crashes in Sri Lanka than during the 10 years of the war. And even during the war, a similar amount of people passed away, lost their lives to and from road traffic crashes. So what should we do? As an expert committee. We have been working towards preventing, reducing, controlling road traffic crashes for a long time. I have been there for a long period, more than a decade, but all our kind of efforts have gone to waste, I think. So since becoming the chairperson of the road traffic crash expert committee of the Sri Lankan Medical Association, one of our main objectives have been to establish a task force, a committee. We used to call it even a presidential task force for the prevention and control of road traffic crashes, its associations, injuries and deaths. Why a task force? Because as I told you previously, this preventive effort, this reduction effort, this mitigating effort should be a collaborative effort, basically involving, taking into, talking to, working with all the stakeholders that can and should do something to prevent road traffic crashes. So that is why our objective is to establish this committee. If it comes under the president, it will be really good, because usually now, if the highest authority in a ministry is the secretary, and secretaries don't come to meetings called by other secretaries, but the presidential secretary or secretary to His Excellency the President can call all secretaries to one table and start a collaborative effort, make them talk to each other, tell what they are doing. And for this purpose, I and the committee think this task force, this group of people, but with authority to work towards one objective, reducing, preventing or controlling road traffic crashes, is important. So again, we have been basically trying to talk, writing to successive presidents for this effort, and we have come some way, and we sincerely hope in the very near future, with the support of the present President, His Excellency Ranil Wickremesinghe, we will be able to establish this committee and try to prevent this national calamity. Thank you very much for listening.